Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you are confused about your weight, if you have questions about weight medication, and if you want medically based answers to your weight questions, you are in the right place. Welcome. And if you're watching this in January, I'm doing January daily office hours. So I'm doing the regular office hours every week, but as a special bonus in January 2025, I'm doing daily office hours in the YouTube shorts as well. So please keep sending in your questions. They are always so good, so interesting, and they help so many people. So you can leave comments on videos. You can leave a comment on this video. I'll find it. And thank you so much for writing in. So as a caveat, as always, I can't answer personal medical questions. I can't give personal medical advice because I'm not your personal doctor. So if your question is a little bit more leaning towards the personal, I will change it a little so it's more broadly educationally applicable. But let's get started with today. So first question is it worth it to go on Ozempic, I think, or similar medications if you only need to lose 20 pounds? Such a good question. I really think, it really, as always, it depends on the individual, but there's no such thing in my book as like only 20 pounds because it really depends on where somebody's starting from. 20 pounds is 10% of 200 pounds. I mean, it's depending on where you start from, it is often, can be, for some people, is very much a significant amount of their total body weight, and it really depends on your starting BMI and what you're looking for. And these medications, probably the best way to start to think about it is to think about, and BMI, it's not a be all and end all, but it is helpful in this situation, is your BMI 27 to 30 with at least one medical issue that's related to weight, such as high cholesterol, high blood pressure, sleep apnea? Are you in that BMI category, or are you in a BMI of 30 or above? Because those are the categories that these medications were approved for. And if you think about it that way, then you would qualify for treatment if you're the right person. Of course, have a conversation with your physician, but there's no like right amount of weight to lose. It's really looking at your weight in terms of where you are now, where you want to be. But I don't think there's such a thing as like just 20 pounds. Or it's important to zoom out and look at where is this person starting from and where do they want to get to, and what's that total, what's their goal body weight, what do we feel like would be a healthy BMI for them, and go from there. So that might be 20 pounds, it might be 30 pounds, it might be 50 pounds. It really depends on the person. But I would start looking at it from, does this person fit into one of those BMI categories? And if so, then usually they would qualify for the medication. Whether they want to take it or not is a separate question. But I'm certainly, if somebody has a BMI of 24 and they want to lose 20 pounds, that's not usually an appropriate person to be on these medications versus somebody who has a BMI of, 29 or 30, and then it's a very different conversation. So that's where I would start. But what a great question. And yes, so that's where I would change my perspective to look at if somebody's a candidate or not. Next question is about Contrave. When used by itself, does it increase blood pressure / worsen hypertension in your experience? Yes, it definitely has the potential to do that. Contrave can be a very stimulating medication, and really that comes primarily from the bupropion, which has that potential. So it's never a medication that I'm going to start for somebody who has uncontrolled high blood pressure. You definitely have to have that controlled before you think about starting something like Contrave. And then if you add something like Contrave, whether or not they have normal blood pressure or controlled high blood pressure, you do want to keep an eye out for that, because that could be one of the side effects as well. So excellent question. This is somebody on a GLP-1 receptor agonist. It made me dizzy a few hours after the shot, feeling dizzy constantly. I lost a pound, but no other symptoms. I'm going to shorten this a little. Feel really dizzy, lying down for hours. It really is a miracle on how it reduces food. I think cravings is what they mean to say. I'm very upset. It was my dream, but this dizziness, which I had no idea was possible, can't be tolerated. Yes, so some people, depending on the GLP-1, you could get dizzy. And just because you have dizziness on one doesn't mean you're going to be dizzy on another. So don't necessarily, talk to your prescribing physician, but I would never cross them out as an entire category in terms of whether somebody was a candidate or not. Always, if you have new onset dizziness, if someone comes with new onset dizziness and they started a medication, yes, we're going to go through all that risk profile, but I'm also making sure that it's not coming from someplace else as well. You have to make sure that the dizziness is, you've thoroughly worked that up. But let's say I've done all that. The other things to think about are your other things that can cause dizziness that are kind of more secondarily related to the medications are things like if you're really dehydrated, you haven't been eating a lot, or maybe you've had a lot of diarrhea, you just can't keep anything down. A lot of people are going to feel dizzy just because their blood pressure is low. So that's one thing that I would be looking out for. We don't want someone to get too dehydrated. And also sometimes what can happen is, you want to make sure blood sugar isn't dropping too low. That's usually not as much of an issue for people who are using it for weight. For diabetes, it's another story. But people who are using it for weight, usually their pancreas is not, we don't have to worry about hypoglycemia as much as we would somebody who had type 2 diabetes. But the other thing you do that I do think about is if somebody's on blood pressure medications and, their weight's here, they start the medication, their weight comes down to here, you still are treating, if you keep them on that blood pressure medication here, sometimes that's too much for people, and some people are losing a lot early or they get dehydrated. There's a lot of different ways. There's many different ways to get dizzy on these medications is what I'm trying to say. So, of course, if that was the person's first dose or second dose, they probably haven't lost a lot of weight to affect how their blood pressure medication is going to be affected in their body at this new weight. But essentially, there are many different ways to be dizzy just by the medication alone, or by your fluid status, your blood pressure status. So definitely, with any of these symptoms, definitely check in with your prescribing physician. But I also wouldn't cross necessarily, if I had a patient who got dizzy on one, I don't think it always means that they might not be able to tolerate another one. So great question. Next question. I have very loose bowel movements first thing in the morning, then constipated the rest of the day. What would somebody do in this situation? Okay, so it really depends on what is normal for you too. So loose, constipated for the rest of the day, but loose bowel movements in the morning. For me, if I'm talking to somebody, that usually doesn't mean that they're, constipated, because they're having bowel movements every day. And usually constipation is more, unless somebody has, unless they're normal is like 3 to 4 bowel movements a day, then you could say going down to 1 a day might be very constipating for them. So depends on where somebody's starting from, but if they're having a bowel movement a day, usually they're not constipated. It sounds like the primary issue here, the more distressing issue would be, the loose bowel movements in the morning. And so if I had a patient like that, the first thing I'm going to talk to them about is what they're eating. That's the easiest to change. And I want to make sure that they're having a lot of fruits and vegetables, if they can tolerate them, getting a lot of fiber from natural sources, and staying hydrated because they're losing water if they're having these watery bowel movements. Sometimes I will add Imodium for somebody. It really depends on how severe the diarrhea is. I would much prefer to go via the kind of natural change what you eat route, but I think there's a time and a place depending on the person for things like Imodium as well. But also if they're loose bowel movements in the morning, but they don't have another bowel movement to the next morning, I wouldn't categorize them necessarily as constipated either. But again, for any of these, of course, you want to talk to your prescribing physician who knows you best. And you want to make sure, and I've talked about this before, of course, diarrhea and constipation are a nuisance, but if they are severe enough, they can actually cause some pretty significant side effects that, in some extreme cases can be life-threatening. So as always, consult your prescribing physician. But if someone's having, loose bowel movements, usually the first place I will start is just checking out what they're eating and seeing how much we can optimize that. And then maybe adding some pharmaceutical help in the shape of Imodium as needed. But I really try not to do that because I try to let the bowels kind of work things out as the patient progresses on this medication. But again, that's also a patient that I might feel, maybe needs a month or two extra on a dose just to let their body adjust to it, because there's no race and you want to feel good on the medication while you're on it. The only way you're going to stay on it is if it's tolerable. So that's going to do it for today. Thank you so much for all those really wonderful questions. If you have questions afterwards, please leave them on this video or another video. If you want to work with me directly, if you are somebody who is wondering, ooh, should I do this on my own? Should I take one of those meds? I'm really not sure. We should talk. I'll leave all that contact info down below. Thank you so much for watching, and please be well.